So, hello, and thank you so much. We were sure we would be alone here because it's lunchtime. So, first of all, deeply, we are very happy and grateful you decided to join us today, and we hope you will not regret it. I'm Andrea Bocca. I'm together with my colleague, Dr. Marco Manz, and we'll be sharing with you the story and the science behind Sunekos Performa. Just to start, who knows Sunekos Performa? Hands up. Whoa, Tiziano, you want to take a picture of this so everybody knows it. So, and who's new to Sunekos Performa? Hands up those who are new to the family. Okay, so we hope we can bring new things to the ones who already know it and convince the rest to join. These are my disclosures. I'm a dermatologist. I train for some of the brands that I'm sure you already know, and I also do clinical trials for many of the companies. So I'm lucky to see where we have a lot of branding and where science is more important. So today is definitely about science with Sunekos, no doubt about it. We'll start with a general overview over the product, some of the things for sure you already know. Be patient with us, those who already know them. And then Marco is going to present to you a very new and very nice clinical study to convince you that Sunekos is always about new and new science and always new and new way to assess how the patients see the product also, because now we know that it's not enough for us to love a product, but really it has to touch the eye and the heart of our patients as well. You know, many times I wake up in the morning and I think, why do I do what I do? Because I started by doing science, I was working in the lab, and then I switched to aesthetics. So always I'm thinking, was it a good idea? Why did I make this move? And I'm sure you're on me with this. Because when we start our day, we provide quality of life to our patients. We make them feel more beautiful, and sometimes objectively more beautiful, but many times feel more beautiful. And this is very important because I know science is driven, so we are driven by science, but also the patients are driven by social media and by crazy expectations. So when we start our day, it is about beauty. But how do you quantify it? Like, how do you say which are the perfect lips, nose, neck wrinkles? There's so much beauty out there and so hard to quantify it. And this is where Sunekos really is coming towards us, because in terms of volumizing and perfect volumes, how many times did you make a patient look perfect? Who made one day a patient look perfect? Who created perfect beauty one day? Good one. I also created beauty one day when I created my daughter, the only time when I created perfect beauty. Now I look back at the same picture and I say, man, she looked like a monkey on that day. But I hope you agree with me. But literally, I remember that on that day, looking at her, I thought she was beautiful. So my own perception about beauty changes easily. So then I have to understand my patients when they want natural lips, but more natural and even more natural. So with volumes, there's nothing standard. And now I thank God my daughter changed. But I always keep in mind that, because then it's easier for me to understand that my patients don't know what they want. So in terms of volumization, there is no standardization, and science proves this. I mean, this is only one article analyzing more than 1,250 publications, reaching at the conclusion that Plato reached more than 2,000 years ago, more than 2,300 years ago, and that beauty is in the eye of the beholder. So I know what's beautiful for me, Matt knows what's beautiful for him, so we have our own perception of beauty, but things go way beyond. Because, I mean, we try to be scientific, but we have to be artists as well, to make this merge, to create wonders, but many times we have to be psychologists as well, because it's not about creating beauty, because beauty is in the mind of the beheld, is in the mind of your patients, so they have to feel the beauty. And many times we think, are we treating the face or the mind? Who feels you're treating the mind more than the face? No doubt, we totally agree on this one. Good, no doubt about it. But there is something universal. No matter the age, the ethnicity, there is something unique and something universal, and this is the skin quality. Maybe you want bigger lips, maybe you want a more defined jawline, but definitely everybody wants to have a flawless, good-looking, healthy skin. And now, finally, this is where patients stand as well, because we always knew it. I mean, how many in the room are dermatologists? How many are plastic surgeons? We have in common the skin quality, but we have to admit that for you it's more about quantity, and for us it's more about the quality. We don't have so much in our hands to deal with the quantity. But definitely now the patients are joining us, because due to social media that we dislike many times, it helped us with something, with patients understanding the need of skin quality. Unfortunately, they understand it, but still they're far from, because you hear, if you go here to the booths, everybody's saying, no, now volumes are changing to skin quality. Data doesn't say that. I mean, the pink is the toxin, there's still a lot of toxin, of course we need it. The blue are the fillers, so we still need a lot of volumes, and that's for sure, because volume replacement will not be fixed by skin quality, so we need both. But we definitely need to focus a lot on the skin quality, because this is really the common thing that will please the eye in the first moment. When you look at somebody, you don't say, oh my God, what nasolabial folds. You notice if they have a glowing skin, and this is what Sunekos helps us with, to really regenerate it from within. You like the results with Sunekos? This is Photoshop. So, expectations, the number one enemy of us. Unfortunately, I mean, no matter how good I can be as a dermatologist, how good you can be as a plastic surgeon, some things only happen with Photoshop. So we have to really think about the expectations, because I think that we provide amazing results each time. The only time a patient will come back to you saying, I didn't notice much of a result, was the time when you were not able to explain from the first moment what result you will provide. Because many times they think that, hello doctor, what an honor, thank you for joining. So this is the problem. Many times we hope you can be 80 and still look 20, which is impossible. And this is where prevention comes into picture. And we'll show you some really interesting data on prevention as well. Now the problem is that our patients now don't come with a picture, I want to look like my neighbor anymore. Now they come with a picture saying, I want to look like myself with a filter. And the problem is that filters, they distort anatomical landmarks, so they totally remove your nasolabial fold and your tear trough and so on. So this is something that we really have to fight. But with a good understanding and the right product in our hands, we can really go into battle. Because something that we know for sure is that whatever you do, time won't stop, so chronoaging will always be there. And it's day after day. Even if you do an amazing facelift today, and we have here some very good experts on facelifts. Even if you do a very good facelift, from tomorrow your patient is 1 day older, not only due to chronoaging, but to photoaging as well. So this is very important. Knowing that whatever we provide when we say skin quality has to be sustainable. It's not only about immediate results. It's about what the product that I'm doing today to my patient will impact him in 5 years, in 10 years. Because I mean, you struggle a lot to get one good loyal patient, but then what you want is that patient to stay with you. But that also means that whatever you're doing today will have an impact for what you will be doing from now in the following years. And this is very important, and not only safety, not only efficacy, but safety as well. Because we cannot provide magic to them, and we know, okay, this is Photoshop, so this is not something that we can do, but we can drastically improve skin quality. However, they come in with a dream looking like this, and unfortunately, many times they end up looking like this. And this is one, of course, there are not many, but this is one of the examples that you have with polylactic acid on the neck. So think, if you cannot provide magic, make sure you don't provide the opposite. So always put safety at first. So think which is a candidate for collagen stimulators and which is a candidate where you really want to do regenerative medicine. Because I think that if you would tell any of your patients, would you rather have a single injection, but I mean, this is the risk, or you can have a full protocol of a different product? I mean, think what they would choose. So keep this in mind, because that's not a single case. There are many publications, not only fibrosis and nodules on the site of injection, but also their migration injected in the tear trough, and you see here migration to the buccal area, and then you see ischemia, and you know that if this happens with collagen inducers, you have a big issue, because it is not something that you can dissolve, and you see their consequences. And think that on an average, from all the cases, and I hope there will be very few for you that you will ever have to manage the side effects. If these side effects happen with collagen stimulators, that I know they're very trendy, yet less than 10% of the cases will fully resolve of your side effects. So always keep this in mind. Sometimes we need to go extreme, but in many of the times, if we start in time and we plant good expectations in the mind of the patients, you do not need that. You can really go on the regenerative, on the biomimetic pathway and get amazing sustainable results. Or even better, sometimes when you need it, you can combine them. So always keep in mind not only what efficacy I have today, but the long-term things. And it's not only about collagen stimulators, because we do a lot for skin quality. But what do all of these things have in common, from the older things like microneedling to the most trendy ones? Inflammation. And for many years we thought that this is amazing. We create inflammation, So we regenerate and we improve the skin quality. Inflammation and regeneration don't go hand in hand, because now we know that in addition to chronoaging and to photoaging, we have inflammaging as well. So by inflammation, you also have reactive oxygen species. You have proteolytic enzymes coming into the picture that cleave elastin, collagen, proteoglycan. So over time, you're not anti-aging your skin at all, on the opposite. So inflammaging is a big enemy. And it's not only that. When you have excess of collagen type 1 and type 3 creation and disbalance, the resulting process is nothing than fibrosis. And this is why we know after, for example, doing collagen stimulators, after some sessions, you know that the cannula is hard to move anymore into the skin because fibrosis is there. So this is why we need to keep in mind that only working by inflammation is not sustainable anymore. Now, 2025 is the point where we have so much science behind it that we need and we know that regeneration is the right path to go. And that in the extracellular matrix, we need to recreate homeostasis. It's not only, of course, collagen type 1 is the most predominant one, but you need a balance between them. Because if you only have too much type 1 and type 3, it's only about matter of fibrosis. Think even hypertrophic scars, they have excess. And do they look good? Of course not. Because in addition to collagen type 1 and collagen type 3 floats within the dermis, we need anchoring proteins. And for that, we have collagen type 4, which forms the anchoring plaques, and collagen type 7 that anchors the fibrils to one another to organize DCM. And this is extremely important because you see there in pink the collagen type 3 floating and then it being anchored. When anchorage comes into picture, you can talk about skin tightness, repositioning of the volumes, and so on. Now, if this is so, why does the industry only talk about collagen type 1 and type 3? Because these are the ones that inflammation generates. But these are not the ones that heal, that regenerate the extracellular matrix. You need a complete overview. And it's not even only about collagen. You have fibronectin, anchoring the collagen to the surrounding cells. And then you have elastin, which is true, it's only 2% of the dermis, but it's extremely important. For example, when you do the pinch test and it's positive, the skin is lacking the ability to contract, is not only collagen, elastin is fundamental for that as well. So all these proteins, they need to merge and you need a balance between them to really be able to talk about a youthful appearance of the skin. Okay, so you don't do it by inflammation, but how do you do it then? Biomimetic, biophysiological approach, and this is the CD44. And no doubt about it, this is the right way to go. And this is the principle behind all the Sunekos range. And we have 2 for the face, 2 for the body, and now we have also a product for vaginal rejuvenation, which is the Intercare. So always Sunekos comes with more and more news, but always in the same direction, regenerative medicine. So something that's sustainable, not only today, but on the long run. And if today we talk about Sunekos Performa, tomorrow we'll be talking about cells, so join us tomorrow also on talking about the body part. For those of you who don't know it, because the rest, I think you saw this slide so many times, but because we have new people in the audience, we want you to know that Sunekos is coming from Italy, from a company that's called Professional Dietetics, who for almost 30 years now have been on the forefront of research and development as global leaders on amino acids. They come from a background of clinical nutrition, wound healing, metabolic diseases, clinical nutrition, serious medical stuff. Now, of course, with the same methodology used, for example, to decode what's the best sequence to give us clinical nutrition for a patient with sarcopenia. They use the same methodology called platform to decode what's the best sequence for skin regeneration. And this is called HY6AA. You have it here. And this is patented, protected by international patent of formula. Many international awards in the back, including the safety and beauty, because again, it's not only about top efficacy, but also extreme safety with them. A lot of publications. If you want to see any of the videos that we'll be sharing with you today, any of the publications, I'll share with you my QR code at the end. Just write me and we are happy to share absolutely everything out there. And we have more publications also coming out and a lot of news always on the pipeline. But the composition looks very simple. I mean, Hussein was asking me earlier on, what, this is also polynucleotides? No, this is something that actually works. And this is hyaluronic acid and amino acids. Well, that's simple. I mean, so many products out there in the booth have this in their composition. So then what's so different? So let's go first of all to the hyaluronic acid. This is low with Performa. This is low weight hyaluronic acid. But more than that, this is medical grade. So you have over 99% purity and closed telomeres. So this allows you to take to the minimum the inflammatory response. And this is extremely important because it is low molecular weight, the one that's highly able to stimulate the CD44. The high molecular weight, on the other hand, it's very nice. It's anti-inflammatory, it's antioxidant, good free radical scavenger, but its ability to stimulate the CD44 is minimal. So this is why when you repeat it and when you want strong impact in your skin regeneration, you need low molecular weight, and this is what you have with Performa. And then in addition to that, you have the patented 6 amino acids. And the patent is not only about which 6, but also the quantity, the ratio between them, because this is the game changer. They tried so many formulas throughout the years to really reach to the best option for skin regeneration. Because you think, okay, but in addition, I can put 7. I mean, there are products with 7 amino acids and even more than that. Why you don't put more? Because more amino acids means more competition. Amino acids, they compete for the same soluble carriers. So when you add more, actually your efficacy is going down, not high. And this is very important, and this is the proof behind it. Because you have some elastin, minimal elastin production with a lot of products, but this is what you have with Sunekos. And actually here, you have 7 amino acids. Do you like it more? No, we want high efficacy. We don't want high composition, a lot of things inside and really high quantities. No, we want balanced, exact composition for science. Look at collagen. And it's not only about more collagen, it's about the types of collagen. Because for the first time, you have sustained high production of collagen type 4 and type 7, in addition to the highest production of elastin. Look, the yellow line is a sunburn. Even a sunburn can create what? Elastin. But what a pity, it was by inflammation, so then elastosis comes into picture and it's gone. While the green line, this is Sunekos, so this is long-term sustained production of elastin, something that's produced by a biomimetic pathway, so it's there to sit and to help you within the skin. But, I mean, there are some other products that have low molecular weight hyaluronic acid inside. So why you don't have these results with them? Because normally when you have non-cross-linked AJ into your products, and all the products of the Sunekos range, they're based on non-cross-linked AJ, normally the duration in the skin is very short. Why? Hyaluronidase comes and cleaves it. Okay, so why Performa looks, oh my God, so different? Why it stays so much when it's still not cross-linked? Because these patented amino acids, they come around the hyaluronic acid. They're strongly charged with a positive, especially you have the lysine inside, which is strongly positive. So they come like a shield around the molecule of hyaluronic acid, protecting it. Because they're hydrophobic, so they push the water away, and with that, the hyaluronidase. So that is how you have a 40% decrease of the hyaluronidase activity, or in your molecule of the AJ. So that gives the time to the AJ molecule to sit within the skin and keep stimulating, and this is what is giving you the time to produce collagen type 4, type 7, fibronectin, and so on. And you have here also fibronectin and elastin. I mean, you see here, I know peptides and polynucleotides and everything is very fancy and very trendy nowadays, but think about the science in the back. I mean, what are proteins? What is collagen and elastin built from? The bricks. What are the bricks? The amino acids. While with polynucleotides, you need enzymes to come and cut them down to turn them into what? Small fragments of DNA. Oh, but they do DNA repair. True guided DNA repair would be a Nobel Prize. So without doubt, then you would hear it in the Nobel Prize. So sustained and controlled DNA repair, we are still far from that. But from those small pieces, they go into metabolic reactions that end up in the end in having some impact on protein synthesis. While with the amino acids, you have direct production and proved production of these. And this is why it's not just about skin regeneration on the aesthetic part, but also on the health of the skin. This is why you see the erythema improving. This is why you see these chromias improving. Because in the end, when you have homeostasis within the ECM, everything works better, not just the fibroblast. You have neoangiogenesis. You have regulation of the functionality of the melanocyte. So, of course, when you have inflammation, the fibroblast is overactive, then it overactivates the melanocyte, so you have dyschromias. Sunekos has the opposite effect. Because of the anti-inflammatory unique patent of amino acids included, it is purely an anti-inflammatory product, so it regulates DCM, but also brings into picture the counteraction of inflammation. This is the indications, everything that has to do with the skin quality improvement. Contraindications, I mean, they're the regular ones. They come from regulatory pregnancy, breastfeeding, active dermatopathies, known allergies, etc., something that you already know. What's worth pointing out is the side effects, because the safety profile of Sunekos is really at its top. Why is this? You will never have ischemia, granulomas, nodules, late onset inflammation, because this works really in synergy with your skin and not through inflammation. And this being said, I give the word to my amazing colleague, Dr. Marco.
Hearing such wonderful information and said so lovely, I relaxed, and I hope you did too. And thank you very much for being with us. My name is Marko Mance. I'm a plastic and aesthetic surgeon. I'm based in Zagreb, Croatia. And I want to talk today about a study that my colleagues conducted at the Gemelli Isola Hospital in Rome. And for those of you who aren't familiar with this hospital, it is actually the Vatican Hospital. It's the hospital where the Pope goes. And this wonderful, wonderful study conducted by Emanuele Bartoletti and Dr. Gloria Trochi asked a question that many of us as physicians often skip, often don't have time for, often we don't even think about it. And it was entitled Evaluation of the Efficacy and Safety of a Premixed Injectable Solution, so Sunekos Performa, with low molecular weight hyaluronic acid in the 6 amino acids in the treatment of facial skin aging. And why this study is different, because Andrea told you many of the studies and many of the in vivo, in vitro, and clinical studies that we've had and the results we've had with the production of not only collagen type 1 and 3, but the 4 and 7 as well, the fibronectin and elastin. But what we asked in this study, what my colleagues asked is, okay, this is all wonderful. It's science-backed. We've heard this before. We love it because of it. But what do the patients think of it? How do they feel? Because if you look at it, at the end of the day, the patients that come to us want to feel better. We often forget that, especially with the time, with experience, with the hundreds of hours that we put into our day, and at the end of the day, the exhaustion we feel, we forget that when someone's sitting across from us going, "Doctor, please do something, my skin's dry," or "I'm starting to sag, I'm getting old," it's because they want to feel better. Okay, so the primary goal of this study was to see just that, the subjective satisfaction of our patients. The secondary goal was to back that up or see if the results correlate with each other with objective results using corneometry and elastrometry. Are the results backed up by objective science? And of course, the safety endpoints. So what we did is we took a product, a 3.5 milliliter premixed solution, Sunekos Performa, and injected 50 patients using the Sunekos protocol of 3 sessions every 15 days. Our follow-ups were 1, 2, and 6 months, and as I mentioned, we did objective and subjective scoring. And this is what we found. When we asked the patients, how do you feel? Do you feel improvement? Very much improvement or no improvement? We found that at 2 months, 84.4% of the patients saw some improvement. 85% felt better because of the treatment they did. 15% saw no change. Okay. What about after 3 months? Well, after 3 months, we still maintained a high level at 76.5%, saying they saw an improvement and they felt better. And of course, a very much improved score of 30%. And this is after 3 months. This is an initial. We're used to doing a filler. They look in the mirror. They have the volumization right away. This is gradual. This is regenerative. This is exactly what Andrea was talking. By adding a patented formula that is proven to stimulate the fibroblast in a homeostatic way, without inflammation, and I don't know how many lectures you've heard and will hear over the next 3 days, but keep in mind how many of them get results in an anti-inflammatory mechanism, because that's the key. Because we've all heard of inflammation leading to aging skin, hyperproduction of collagens, especially collagen type 1 and 3, but It's the balance, as Andrea said, that gives us the best result. After 6 months, and it doesn't sound like a long time, what's 6 months? Imagine that is, if we treated all of you today, that would be September 26th or 27th. September. We haven't even gone into spring. We're just getting into it. We haven't done the summer months, the autumn. 6 months is a long time. And what we found, which was wonderful, is that 53% of those patients still, after 6 months, felt improved skin quality. And 17.6 still felt very much improved after 6 months. Now I ask you, how many treatments have we been doing, the last 10, 15 years that have given us great results? And after 2-3 months, our patient comes in and goes, okay, doctor, let's repeat it. It all went away. A lot of the technology we had, a lot of the science we had didn't know about constant regeneration, long-term regeneration. But with Sunekos, we're seeing long-term results. And this is proven here in this study after 6 months. And it is my experience from my clinic. I know, Andrea, we talk about it all the time. The patients, even up to a year, after a year, still say it is still better than it was when I first came. Constant regeneration, constant anti-inflammatory action, repeating Sunekos gives us those wonderful results, okay? And the main question, are you happy? Were you happy? Were you satisfied? Well, what we found in this study is that only 4% of patients after 6 months weren't satisfied with the treatment. 96% of our patients said they were happy with what they did. So we, over dinner, discussing it, going, okay, other than the results, is there something else? Well, yes, it's the safety.
Come to the front as well. There's many seats in the front as well. Don't stay up. Come join us. We're very friendly, I promise.
96% are happy with the treatment. 96% are happy with you. And this builds on the client-doctor relationship that we are so seldom trying to build. We are using all of our energy to make our patients happy. And the results that we found shocked even us. And to back this up, and we've backed it up, Andrea's mentioned the previous studies, but in this study we back it up with elastometry and corneometry, showing improved elasticity over the months and improved hydration. So the patients that were feeling better and seeing improvements were actually, it wasn't a placebo effect, okay? And just some before and after pictures, and this is a wonderful 56-year-old woman, and you see the decreased fine wrinkles, the increased hydration, the increased tone and quality. But what about us men? Well, Sunekos is a wonderful product also for us. I use it all the time, not just because I have it, but because I love it as well, and because of all the aspects and the safety that we mentioned. But this is a 63-year-old gentleman, and we see the wonderful, wonderful results. And of course, some high-tech imagery, reiterating the hydration, the increased integrity of the skin, the balancing of the skin tone. And this is a 53-year-old. These are 50 plus individuals. These aren't 30, 35-year-old young patients. These are 50 plus. And what we've been told up to now is that the regenerative capacity of this age group is greatly diminished. And yet, we are seeing results such as this. And the reason, and I know we've said it, but it's so important, is because when you decrease the inflammation and take away the inflammatory stimuli, you're able to regenerate all the components of the extracellular matrix in a balanced fashion. And it is that balance that gives you the best integrity, the best quality, of skin and collagen formation. And in the end, what this study proved, the best satisfaction. Your patients feel better. Not a few weeks after, not a month after, up to 6 months and beyond. So in conclusion, Sunekos Performa is an effective, safe, and well-tolerated treatment for your patients. And I'll hand it on to Andrea to bring us home and conclude.
So in the end, this is it, and this is your magic, making your patients choosing to come to you. But then the products that you have in your hand will really make them come back. Because in the end, it's about how the patients feel, but also what the others have to say about it. Because when you go out and people say, what have you been doing to yourself? You look very glowy. How many times did it happen to you that somebody would tell you, oh, your nasolabial fold looks better? So it is definitely a need of volumes, but it is always about the skin texture, the first thing that we see out there. So this is why I think that what we have as a strong point of this study is you seeing that the patients really see and feel the improvement. And this is what we are every day working for. Please join us in the front. Have a seat over here. It's comfortable. We all fit. And I will just show to you, to those of you who are new to the product, how to get the results that Marco was showing you. And we have the Sunekos 1200, who is the only member of the Sunekos family, who's based on high weight hyaluronic acid, because yes, we do need that as well. First of all, because we are exposed to photoaging, so we need the antioxidant, the free radical scavenger of high molecular weight. But that will be a first step. We do it once in the first session. And as a bonus, we get the initial immediate results that patients see. And this is something that's a big plus. But the big thing, remember, it's not about strong stimulation of the CD44 with high molecular weight hyaluronic acid, because some people think it's stronger, it's more efficient because it's high molecular weight. No, it has a different papers. It plays a different role. So we mix the two vials that we have and we distribute them over the face, pretty much like playing as if it was a filler, because it gives you an instant, immediate support, but that's not the result that you are getting on the long run. It's skin repositioning that you are getting. However, as soon as you can, you want to provide something that's visible, and this will be without doubt the Sunekos 1200 that you will be doing only once in the first session. You mix the two vials, one is more liquid containing the amino acids, and the other one is more viscous containing the high molecular weight, non-cross-linked hyaluronic acid. After the mixture, you have 3 milliliters that you shall be placing over the face. I'll be showing you here the typical protocol, but of course we adapt. It is really easy to tailor to whatever the needs are. Normally we would see some nice immediate impact on volumes in the piriform area, malar region, zygomatic arch, mandible angle, sometimes the mental crease, sometimes the marionette line, depending really on the patient. So you spread it over 5-6 points on the face. Each point gets around 0.3 milliliters. You can really tailor it. The place of placement is the subdermal region. So you want to take a cannula and scratch the dermis from below. You can put it as a bolus or fan it a little bit. It's really up to you. So it's really a playful product. It's really a nice immediate result that you see, but it's also a strong anti-inflammatory and big free radical scavenger that you're putting in the skin of your patients. And everybody who, let's say, past 30, we're already exposed to a lot of photoaging, so we get a lot of benefit out of it. If you want the videos, please just write to me. I'll share everything with you. And then it is the Sunekos Performa. The Sunekos Performa is the one that shall be repeated, that is part of the protocol. And it is Sunekos Performa who's based on low molecular weight hyaluronic acid, who's strongly able to give you that stimulation that we've been talking about to get the collagen 4, 7, fibronectin, elastin, high amount production. You have again 2 vials inside, but each one is for an individual treatment. One can cover the face, one can cover the neck, the décolleté, the hands, and so on. So you do not need to mix them. Each one has 3.5 milliliters inside, and you shall be repeating the Performa. In the first session, you do it together with the 1200, but then only the Performa you repeat it every 2 weeks. And remember, this is a protocol. Because first we repair, then we rebuild, then we maintain. Because when we start putting back the fibroblasts to action without using the inflammation, it takes a while. It first gets rid of the old distorted collagen fibers and then starts rebuilding the new one. So always remember, because everybody asks, can we do just a single session? My patient wants to pay only for one session. One session will give you immediate results, of course, hydration, glowiness, but this is not the high protein amount production that you can get on the long run and that you are really aiming for. You place it over the face in boluses, not classical mesotherapy technique. Mid face, lower face, upper third, it really depends where you need it. But boluses, you go into the skin like if it was a skin booster, deeper, around 2 millimeters into the skin, each point 0.1 milliliters, so boluses. Exception, periocular and perioral. Here you do classical mesotherapy. Very superficial blanching micropapules, 0.02, 0.03 milliliters each one. For the rest of the face, bigger quantities. Not because they are visible if you place them too superficial. Anyway, it's non-cross-linked, but because they're more efficient in that plane. And here you have just some videos, which I hope they are quite illustrative. For the face, you put a line from the ale of the nose to the tragus. You mark the mid-pupillary line, and from there you start injecting. You try to be perpendicular to oblique to the longer lines. Why? Because we are creating, remember, anchoring proteins. Collagen type 4, type 7, so those are anchoring, including fibronectin. So you go deep, each point a bolus, a thumb away, the points one from the other. 1.5 to 2 centimeters, who stays to measure on the skin, roughly 1 thumb away, and you start distributing everywhere. While periocular and perioral, let me start just those ones all over again, just very superficial, small 4 millimeter needle, the thinnest one that you have, or the nanosoft if you prefer, small microboluses, and it's very important the total quantity. Quality is always important as well, the total quantity. Maximum 0.5 mLs per side. So more is not better. That's enough, 0.5. And if your patients already have fluid retention, then keep it down to 0.3. And only Performa in the periocular area. Do not place the 1200 there because that's high molecular weight and you have long lasting edemas. And avoid to put it together with crow's feet Botox because then again the swelling lasts longer. However, if the patient is there for a single day coming to Dubai from Romania or something, then definitely you do it together, but you tell them that the swelling will last longer. In a 40-year-old patient, swelling is not an issue, but in a 60-year-old lady, having 10 days of swelling might be an issue. So as much as you can, keep the Botox and the periocular AJ non-cross-linked, so the Performa in 2 different sessions, so you have nothing to worry about. And now we get to the nice part, the prevention part, because we talk so much about prevention. But prevention is not myself or Marco, I'm sorry, you're not prevention anymore either. So we are not prevention anymore, now we are cure. Prevention is when your patients did not lose any of their collagen and elastin capital when they're still young. Do we have any impact? Because they want now, the young generation wants treatment as soon as possible. And now for the first time, you have the proof, the scientific proof that yes, you definitely get improvement. And this has been done in the Department of Pharmacology in the University of Milan, a very serious in vitro trial with accelerating aging model of doxorubicin. And this is the design, but I'm sure everybody's not so much into details, but I'll show something that's really important. You have here the P16 and the P21 proteins of aging, markers of aging, and you see that this is the young skin, the white column. When it has been accelerated aging by doxorubicin, this is where you get. So a lot of aging, right? Now, however, if this skin was pre-treated with Performa, the aging markers, they are decreased by 40% and 100%. So this is pure proof that if you do it in younger patients, which are not aging yet, you slow down their process of aging, and you have here IL-6 and IL-8, which are closely linked to inflammation. So inflammaging, again, strong impact if you pre-treat with Performa, and also the same on oxidative stress. So very important because, again, now the young generation is seeking treatments, and now you know that you are really providing a benefit to them. Not only now pleasing their mind that they got some injections, but really on the long run, slowing down the aging process that is coming. And love is not guaranteed, but aging is there for everybody. So here you go, only 2 sessions, 2 weeks apart, only 2 sessions of Sunekos Performa. Here, of course, you don't need the 1200 because you have no photoaging yet. So here you only use 2 sessions of Performa, and the third one is optional. So that is it, and this is very important. Now it's not only about the face, it's the neck, the décolleté, and you do it in the exact same way. I mean, nothing is different. You take the Performa and you inject it 0.1 boluses, each single one. 1 vial for the neck, 1 vial for the décolleté. And you do the same on the hands. However, generally on the hands, we have a lot of photoaging because we drive with them, we don't put SPF on them. So on the hands is a very good idea to associate the 1200 dye-band cannula and on top Sunekos Performa with your needle intradermal, because Sunekos Performa is intradermal, and to repeat the combination twice, and that is it. So you get faster results because you use the boosting power of the 1200. But this is for the hands, you don't need this for the face. Very nice results. However, this is Sunekos 1200. So this is giving immediate results. However, we know it is not cross-linked. So these are stable results. This is a 70-year-old lady, and just take a look at the marionette area. This is nothing to do with filling because this is 1 month after the last treatment. So this is repositioning, tightening of the skin that you are getting, and this is the Sunekos Performa long-lasting effect. And this is objective. I mean, this is Visia, as objective as Visia is. And you see here the decrease of the fine wrinkles. Of course, you have much more decrease in younger patients, 40-year-old lady, because they have more fibroblasts to work on for you. Just like Marco mentioned, the older the patient is, fewer fibroblasts. So even in 70-year-old patients, you still get important improvement, but of course, the sooner you start, the better it is. And you see male patients, just like Marco mentioned, and you see the forehead lines, and you know, Botox here, I mean, they can prevent it, but thank you, dog. They were like, timing, yeah, thank you for that. So you see before and afters, because static lines cannot be impacted by Botox. And you see here overall really nice views, but this is what I wanted to see. Pinch test, look what skin laxity deficit you have in the first one, and that is not only collagen, that's elastin deficit. And you look at the left the last video out there, and you see the drastic improvements after Sunekos Performa. So it's not only what you see, but how the skin feels like, how they feel it, and the pinch test is very relevant, and I mean all plastic surgeons use that. Avoid this, no, don't avoid this, you're all experts, so use it 360 degrees around the eye. Just make sure the quantity you stick to maximum 0.5 ml per side. And this is what you're getting, fine wrinkle improvement, but also pigmentation improvement for vascular circles because of neoangiogenesis, which is very important, but also melanocyte regulation. So, and I know a lot of you are fighting with this sport. Very safe, very efficient each single time. Superficial, simple placement all around the eyes every 2 weeks. And to top it up, because we have a lot of collagen type 7 production, which is anti-fibrotic, look atrophic scars, how they improve with Sunekos Performa. And be creative, because I'm sure you all have many patients now who underwent a lot of collagen-inducing treatments, so they have a lot of fibrosis. So use it for that. Use it because then it's going to start happening that you can do treatments for them again. So wherever you have a lot of fibrotic tissue, this is what you want to do in the skin to really regenerate it. So all over for all areas, all ages, prevention, cures, males, females, literally the most universal products you have in your hand. And remember, this is anti-aging because this is fighting inflammation, and this is something that's restructuring the skin. And at the end, you will have, those of you who haven't tried it yet, you will have a very nice gift outside and you get to try it. And I'm sure your patients will give you the best feedback. And if this is not enough for you, I invite you to Romania, because there we have the secret of immortality. We have Dracula, I come from Transylvania. You're welcome, happy to see you. And thank you for joining us. Join us tomorrow as well for the Sunekos. Thank you.